time to get your medical questions answered.
Dr. Zorba Paster is standing by at his office in Oregon. The number to call, 270-9933. Hi, Zorba.
Hi, Zorba.
Can you hear us?
Good to see you guys.
Oh, good. Well, Wisconsin has become one of the biggest hotspots in the country. There is a lot of COVID-19 being reported in every one of our 72 counties in the state. So what is going on in Wisconsin?
Well, it's very clear that what's going on is we have lots of COVID because, among other things, people are not masking enough and they're not engaging in the proper social distancing activities. And I'll give you an example. My wife and I the other day we picked up our dog from the dog groomer and decided maybe we would sit outside, get something to eat. And we saw a restaurant across the street. It looked like a bar, but it said outside seating. I walked into the restaurant, with my mask on and saw 20 people around the bar talking without masks. And I thought, I'm not going to go in this place. Ultimately, we went to a different restaurant where we could sit outside and be properly sort of vented, if you will. So the issue is people are not taking social distancing and masking seriously enough. And that's why we're seeing this outbreak. And it's a shame because we've got the tools to push it down so that we can begin to open up businesses, but we're just not paying attention.
So what can you do?
It's not that simple, but that's really important. And I think it's important, especially because we know the older you are, the greater the risk that we're actually going to die from COVID. I think you have to do the usual things that we do. Wash your hands, mask up. Don't go out to restaurants, of course, unless they are properly, there's only 25% capacity, whatever it is. Don't go into bars and places like that. And talk to people who are younger, who are spreading it. It's the people who are younger in college who often, and they're 30-year-olds are not thinking that this is really a serious thing. And that's about what we can do. Because otherwise, it's going to continue to explode and our economy is going to continue to tank.
And it's become so partisan that, people don't listen to each other.
It's become so partisan. And I certainly have never seen that in my lifetime. And certainly if you look back in the 1950s when the polio epidemic hit and there was immunization, it wasn't partisan then. If you look back to some of the influenza epidemics that have occurred, not the pandemics, it hasn't been partisan. We look at heart disease, high blood pressure. If we look at cholesterol, it's not a partisan issue. Why this has become partisan is very difficult to understand. But the answer is science says we should social distance, wear the mask, and so on. And it's a shame that it's a political decision to wear a mask or not wear a mask. But I think we all have to be adults. We have to be good citizens, and we have to protect one another, and we have to do our civic duty and be responsible. That's the answer.
We're taking your calls today at 270-9933 if you have a question. Bob from Darlington unfortunately got disconnected on the phone, but he wanted to know if he got his flu shot too early. And there's been some confusion about this, Zorba, about when you should get a flu shot and whether or not if you get it now, it will protect you all year long.
So the answer is once flu shots are available, usually, and I say usually, that's the time that you can get them. Certainly after October 1st, that's fine. The issue is when does the influenza season actually strike? So sometimes it strikes in January. That's when the high point is. Sometimes it's in February or March. So there's a little wiggle room on when exactly to get the flu shot. Certainly now is a good time. But if you got your flu shot earlier, the answer is it's probably okay. And that's kind of the way it is with influenza anyway. Once they're available, you can get them. But I generally say once it gets about the middle of September, beginning of October, that's probably the optimal time to get your shot. No reason to get a second shot. And frankly, with people social distancing, wearing their masks, influenza may not be as prevalent if we all get immunized.
All right, let's go to the calls. We'll start with Barb in Madison. Hi, Barb. What's your question?
Hi. I have a question about wearing face masks. I see a number of people that seem to think they can wear them below their nose.
Right.
Is that doing anything at all for protection?
Not very much. Of course, if they cough through their mouth, they're protecting their mouth. The answer is wear your face mask up to your nose. You've got to wear it up here because you're breathing out of your nose, and that's where the particles, the airborne particles, and the other particles come from. So the answer is yes, it should cover the nose.
All right, very good. Let's go to Gary in Madison. Hi, Gary. What's your question?
Yes, I've had vertigo for over a month. I can't get in for a scan for 2 weeks, so I don't know what I should be doing. But I passed out and hit my head.
That's not good.
Oh, if you passed out and you hit your head, that is different from simply having dizziness or vertigo that may come from a viral infection. That's where you really have to talk to your doc. If you passed out, if you hit your head, if you can't get a scan for 2 weeks, the question is that really the right timeline for you? And I think if you can't get in, call your doctor and say, wait a minute, it's 2 weeks to get the scan. Is that really the right thing to do? So that's where you pick up the phone and make a phone call.
We're talking about the flu vaccine. What's the latest on a vaccine for COVID?
Well, the vaccines, all of the experiments are moving on. They're what I call event-driven. They're not determined by time. They're determined by how many people actually get COVID. They want to make sure there's a difference between the placebo group on one hand and the vaccinated group on the other hand. But there are about 4 or 5 vaccines right now in the running, really ahead of the pack. We're talking about the first or second quarter of next year. Even if something begins to come out this year, you've got to have enough safety data, and certainly you need at least 3 or 4 months of safety data before you're going to see whether or not the vaccine is safe. And I think the safety data is as important as the efficacy data.
Is there an update on the AstraZeneca trial at UW Hospital? We reported that it was paused temporarily. Do you know what the latest is on that?
I haven't heard whether or not they've started or they haven't started. It was paused by a neurological problem that occurred, may have occurred randomly, called transverse myelitis. They paused it to see whether or not there were any other cases. That particular study, that's Moderna on one hand, and I can't remember exactly what the American pharmaceutical company was. I think it was either AstraZeneca or Pfizer. 20,000 in the U.S., 30,000 outside the U.S. They're going to look at all the people in there and see whether or not that's only a random case or if there's more than one case. But I don't know when the study is going to restart or if it has.
Okay.
All right, let's go to John in Janesville. Hi, John. What's your question? John just hung up on us. Something about his gallbladder, but we don't really know. And we're waiting for another call to come through as we...
I think something's going on with our phones. Sorry about that, everybody.
Karen, you there? Karen in Janesville, go ahead.
Hi. I recently lost my job.
Oh, I'm sorry.
And thank you. And I lost my health insurance too, and I would like to get a flu shot, but I've been calling around, and it costs anywhere between $50 and almost $100. And I was wondering where I could go, if there's any place I could go to get it for less than that.
Call your public health department. So if you're in Janesville or you're in Madison, you call the public health department. You say, look, I don't have any insurance. Where can I get a flu shot for nothing? And they'll be able to direct you to who actually does that. The drugstores are not going to know it. The doctor's office may or may not know it, but the public health department will really know it. And if you're not sure how to call the public health department, call your local senior center. There's always a social worker on board at the local senior center, and they can often direct you to the right person to get it, because there undoubtedly are free flu shots in your area. I can't tell you where to go, but social workers can.
Well, it's good information.
That is good news.
Important information that there is a safety net out there for people. All right, let's go to Barb in McFarland. Hi, Barb. What's your question?
Hi. I'm wondering if intermittent fasting is a healthy choice for dieting.
Yeah, I think it actually is. That's something that really has been bounced around quite a bit. There are a couple of studies, interestingly, that show if you stop eating at 6 o'clock in the evening and you basically are fasting till 8 o'clock in the morning, and that's a 14-hour fast, that itself may be useful for people to lose weight, because calories taken at night appear to be more likely to go to fat. But a number of people are now doing intermittent fasting where they don't eat for one day during the week, and they seem to lose weight. The real issue is, if you don't eat for one day a week, are you going to eat twice as much when you start eating? So you've still got to pay attention. It's not just the fasting, it's the discipline that comes with the fasting when the fasting is done.
Are we done? Okay, we're out of time. Thank you all for calling in. Zorba, thank you.
Thank you for your patience, Zorba, and everybody else, too. We got through it, and we'll do it again very soon. Good to see you, Zorba. Thanks for your time.